Welcome to This Week in Cardiology. This week we're covering 9 notable papers spanning advanced heart failure management, novel cardiovascular risk factors, and evolving frameworks for lifelong care. Let's dive in. We begin in the realm of advanced heart failure and device-based therapies, where real-world registries and comparative studies are refining patient selection and management. In the European Journal of Heart Failure, the first report from the Italian Multicenter Registry for Mechanically Assisted Circulatory Support, known as ITAM-ACS, evaluated 12 years of experience with over 1,000 patients receiving durable left ventricular assist devices. The registry, spanning from 2010 to 2021, showed overall survival rates of 73% at 1 year, 54% at 3 years, and 42% at 5 years. On multivariable analysis, older age and redo surgery were associated with higher mortality, while a bridge to transplantation indication and being in an INTER-MACS class greater than 1 were protective, highlighting the critical importance of patient selection and timing of implantation. When it comes to rhythm management in patients undergoing tricuspid valve surgery, transvenous pacemaker implantation has historically raised concerns due to potential lead valve interactions. A target trial emulation study published in the Journal of the American Heart Association compared outcomes of leadless versus transvenous pacemakers in over 1,500 Medicare beneficiaries aged 65 and older. The investigators found no statistically significant differences in in-hospital death, 2-year heart failure hospitalizations, or 2-year mortality between the leadless and transvenous groups. However, the authors caution that the confidence intervals were wide, meaning clinically meaningful differences cannot be ruled out, and the study may have been underpowered. In the same vein of heart failure phenotyping, a review in the European Journal of Heart Failure explores the promise and limitations of serum transthyretin as a staging biomarker in transthyretin amyloid cardiomyopathy, outlining how this marker may help clinicians track disease progression and guide therapy, though further validation is needed. Next, we turn to preventative cardiology and the longitudinal assessment of risk factors that shape cardiovascular health across the lifespan. A study in the Journal of the American Heart Association utilized United Kingdom Biobank data from over 260,000 women to examine the relationship between endometriosis and cardiovascular disease. Over a median follow-up of several years, women with endometriosis had an 18% higher risk of developing cardiovascular disease, which was predominantly driven by a 24% increased risk of coronary heart disease. Interestingly, endometriosis was also associated with a 12% lower risk of all-cause mortality, while the association with cardiovascular mortality was not statistically significant. Mediation analysis suggested that having a hysterectomy may partially explain the increased cardiovascular risk, though whether this represents a true mediator or a proxy for disease severity remains a subject for future study. In another study from the Journal of the American Heart Association, researchers analyzed data from the atherosclerosis risk in communities study to evaluate how dynamic changes in frailty affect patients with coronary heart disease over time. Compared to robust individuals, those classified as pre-frail or frail at baseline had a higher risk of major adverse cardiovascular events. Crucially, the study looked at frailty transitions. Patients who progressed from robust to pre-frail or frail status, or from pre-frail to frail, experienced a significantly elevated risk of adverse events. Conversely, patients who recovered from pre-frail to robust status saw a 38% reduction in their risk of major adverse cardiovascular events, underscoring that frailty is a dynamic state and a modifiable target for clinical intervention. This focus on active risk modification aligns with the World Heart Federation Roadmap on Cardiac Rehabilitation. The roadmap advocates for reframing cardiac rehabilitation from a simple exercise program to a comprehensive, lifelong model of secondary prevention. It identifies 5 key roadblocks, including limited patient and clinician engagement and outdated care models, and provides actionable, patient-centered solutions to ensure equitable access and long-term cardiovascular health. On the genetic and developmental end of the spectrum, a narrative review in Heart synthesizes our current understanding of the complex causes of congenital heart disease. The authors emphasize that while chromosomal anomalies and single gene defects explain some cases, most are driven by a complex interplay of genetic susceptibility and environmental factors. Maternal conditions like diabetes, autoimmune disease, and infections, alongside external exposures such as smoking, assisted reproductive technology, and air pollution, represent critical modifiable risk pathways that require proactive clinical counseling and early risk mitigation. Finally, we examine major updates in pulmonary vascular and venous thromboembolic disease. A comprehensive review in Circulation maps key milestones and future perspectives in pulmonary arterial hypertension, a progressive disease characterized by vascular remodeling and right ventricular failure. The epidemiology has shifted, with the disease now more commonly affecting older adults with multiple comorbidities. The review highlights the approval of sotatercept, the first anti-remodeling therapy targeting the activin arm of the transforming growth factor beta pathway, which has shown significant hemodynamic and clinical improvements in clinical trials. Current guidelines favor upfront dual oral combination therapy for most patients, escalating to triple therapy with parenteral prostacyclins for high-risk cases, while regular risk stratification remains the cornerstone of management. Also in Circulation, insights from the API-CAT randomized trial shed light on the prognosis and management of recurrent venous thromboembolism in patients receiving extended apixaban therapy for cancer-associated thrombosis. This trial provides crucial data for clinicians navigating the delicate balance of anticoagulation in this high-risk oncology population, emphasizing the need for individualized, long-term treatment strategies. If you only have time for one paper this week, make it the study on Frailty transitions in coronary heart disease from the Journal of the American Heart Association. This paper is a powerful reminder that frailty is not a static baseline characteristic but a dynamic clinical state, showing that patients who improve their frailty status experience a significant reduction in major adverse cardiovascular events, should motivate us to actively integrate frailty assessments and rehabilitation into our routine coronary artery disease care. Here are the key takeaways from This Week in Cardiology. First, left ventricular assist device therapy in Italy demonstrates robust real-world outcomes, with 5-year survival reaching 42%, and outcomes heavily influenced by age, surgical history, and timing of implantation. Second, endometriosis is associated with an 18% increased risk of cardiovascular disease, particularly coronary heart disease, emphasizing the need for heightened cardiovascular vigilance and risk factor optimization in these patients. Third, frailty in coronary heart disease is dynamic, and helping patients transition from pre-frail to robust status can reduce their risk of major adverse cardiovascular events by over 1/3. Fourth, leadless pacemakers show comparable safety and efficacy to transvenous pacemakers following tricuspid valve surgery, offering a viable alternative to avoid lead valve interactions, though larger studies are needed to confirm these findings. And finally, the landscape of pulmonary arterial hypertension is rapidly evolving with the introduction of sotatercept as a novel anti-remodeling therapy, alongside a clinical shift toward upfront combination therapies and rigorous risk stratification. That's your roundup for This Week in Cardiology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.